Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Expert Fitzgerald faculty clinicians share their knowledge and experience to help you dissect the anatomy of a test question so you can better understand how to arrive at the correct test answer. So, if you're ready, let's jump right in.
The psychiatric mental health nurse practitioner is called to the emergency room for a stat consult on a patient who reportedly was transferred in by ambulance after, quote, acting weird at a party, end quote. Must have been really, really weird to warrant an ambulance. In any event, upon arrival to the emergency department, the psychiatric mental health nurse practitioner finds the patient unresponsive. His respiratory rate is 7 breaths per minute. His blood pressure is 70 over 48 millimeters mercury, and pulse is 40 beats per minute. The skin is pale and clammy, and his pupils are 1 millimeter, but reactive. The most appropriate initial action is to do what? A, order a CT scan of the head. B, immediate administration of naloxone. C, rapid infusion of IV crystalloids. Or D, determination of medical history. And so it will be important that you recognize that B is the correct answer. Absent any further information, this clinical picture is highly suggestive of an opioid overdose, and naloxone must be administered immediately. And I know that the general approach to patient care is that we assess before we intervene. We want to get all the best information before we make a diagnosis and prescribe an intervention. And that is absolutely a good algorithm with which to start. However, in the unstable patient, we have to intervene. The general rule of thumb is, in the stable patient, we assess further to get additional information. In the unstable patient, we intervene. And so, this patient is unresponsive. His respiratory rate is 7. His blood pressure is clearly unstable, and his pulse is much lower than it should be. This is a classic picture of an opioid overdose, but even if it wasn't that classic, the fact that he was at a party and then he was acting weird, and now he is unstable and unresponsive, you just administer the naloxone. The rest of these answer choices, they may have a role here at some point. If he doesn't respond to naloxone, well, then you have to work a little bit harder to figure out what the underlying problem is. It could be another drug of intoxication. It could just coincidentally be another diagnosis entirely. And then a CT scan of the head would be important, a different laboratory assessment, additional history from friends and peers that were at the party. All of this definitely would be important. And it's even important in the context of this patient. But the bottom line is right here, right now, he was at a party, he got weird, he is now unresponsive, he has a low respiratory rate, a low blood pressure, a low pulse, pinpoint pupils, and pale, clammy skin. That just says opioid overdose all over it. And so you just give the naloxone. If it wakes the patient up, awesome. Then you can assess further and develop your longer-term plan of care. And if it doesn't wake up the patient, well, then you can rule out opioid overdose as your problem here. And then we have to be broader in our mechanisms of assessment. But the priority right now in this circumstance is the immediate administration of naloxone. And then, depending on how he responds, you may still need to infuse IV crystalloids because the blood pressure is still very low and we need to get it up. And the immediate way to do that is to increase volume. When he has some stability, or if he doesn't respond to naloxone and you have to, broaden your differential diagnosis, if anyone is available to give you a medical history, of course, that can be helpful. And any diagnostic studies, including CT of the head, are going to be part of the bigger picture. But, straight up with nothing else going on, this clinical picture gets naloxone. And I know you might be saying, well, geez, if the patient's unresponsive, why did they order a psych consult? This happens all the time. It may be that when he first showed up in the ER, he was responsive. And in the brief amount of time between calling you for a consult and you actually arriving, He just lost consciousness, and this is the shape he's in. So as a psychiatric mental health nurse practitioner, you definitely do want to be aware of the concept that if you walk into this scenario, naloxone, before you do anything else, before you ask any other questions, naloxone must be given immediately. And then we broaden our assessment and interventions.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit FHEA.com.